Let's have a word of prayer. Gracious Heavenly Father, Lord God, we thank you for this glorious day you brought to us, dear Lord. We thank you most of all for your Son you sent to be our Savior, dear Lord, that he give his life for our sins. Heavenly Father, we pray now that you'd be with us in our meeting, guide us and lead us in everything we do and say. These things we pray in the precious name of Jesus Christ, our Lord and Savior. Amen.
Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we'll have the roll call now. Warren Fleetwood.
Present.
Mary Key.
Here.
Ken Montgomery.
Here.
Mr. President, we have a quorum.
Thank you. Hopefully everyone's had an opportunity to read over the minutes from our last meeting.
Yes.
Been looking for a motion.
Also move to approve.
Second.
Motion and a second. All in favor signify by saying aye for approval of the minutes.
Aye.
Aye. On to approval of claims. Our pauper claims, $929. CAW 1, $51,338.74. CAW 2, $25,000. CAW 3, $22,603.51. CAW 4, $83,757.80. Innkeeper's distribution, $10,719.60. The blight claims, $644.36. Wheel surtax and ed plate distribution, $74,984.57. Payroll deductions, $160,567.41. Unemployment, $2,848.96. Payroll was $348,604.47. The county general, $241,703.01. Highway is $315,234.71. Sheriff, $45,262.45. ACH, $114,181.78. CAW 5, $20,784.84. And in the court, $15,017.67. That concludes our claims.
I'll make a motion, we approve the claims.
I'll second.
Motion and a second. All in favor signify by saying aye.
Aye.
Aye. Department reports. Do we have any department heads here this evening wishing to give a report? And if so, would you please come to the podium?
Anyway, for the EMS, the end of the month report for March 2021, we had a total of 392 runs. It's broke down with 102 of them being SORs, 277 regular runs, and then we've got it broke down further there. You can see for a total year to build to date build for the service was $801,202.80. Total year to date collected was $299,331.31. Percentage collected so far is 37.36%. The new accounts for March was $275,599.60. We collected $105,369.43 this month, and then we've had insurance adjustments of $12,113.25. Any questions?
Ooh. Thank you, Mr. Pond. Do we have any other department heads here this evening?
I just got the jail report for you. You guys copy of that.
Thank you, sir. Mrs. Hornby, how are you?
I'm Diane, I'm the public health nurse, and obviously, we've been super busy with, the COVID vaccine. We do have a Johnson and Johnson COVID vaccine clinic this Saturday at the fairgrounds. We have 500 doses that we can give, and people can go to ourshot.in.gov. The Johnson and Johnson, I think everybody's familiar with that, but that's the one dose vaccine. So we will be out at the fairgrounds getting that this Saturday. On top of that, they shipped us 1,200 doses of Moderna Monday to do an extra clinic. So I spoke with the sheriff's department to see about doing some of the gel in May. We've contacted numerous businesses and we will start going out to businesses. We're also going to OCU. I think they've got 200 that we'll be doing over there. So we're getting to the place now where we're going to go out to the public. You know, so if a business would like for us to come, as long as they have, you know, around 40 people, we'll come to them. Otherwise, we have vaccine clinics every Wednesday from 9 to 7. Again, ourshot.in.gov. And we do them every Friday from 8 to 4. All those are at the fairgrounds. As far as our testing site, due to we're ramping up more with our vaccines, our testing site hours, which is also at the fairgrounds, have changed to Monday, Tuesday, and Thursday. So we do not have testing on Saturday right now. Part of that was I don't have enough staff. The other reason is a decreased demand. Our testing numbers are going down. We're not testing near as many people as we were when we started. As far as numbers, we gave 4,456 COVID vaccines in the month of March. And like I said, we've got 500, well, we got like 480 something for tomorrow, so we'll probably end up around 500. And then I'm not sure what our numbers are Friday and Saturday yet, but we've got a lot of vaccine to give right now. So anybody that's interested in getting a COVID vaccine, and if they're concerned about cost, if they come to one of the health department sites, they will not get any kind of a bill or anything for the vaccine or the admin fee. So they don't have to worry about that. And I think that some people, that's a concern for them, you know. On top of that, we have been seeing some communicable disease activity that's requiring a lot of time. Hepatitis A outbreak was over around Louisville, pretty strong the last couple of years. We're seeing that more and more come into our area. And so again, I've talked to Tim, and we probably are going to go in and try to do some vaccines in different groups, high-risk groups. We're seeing it in IV drug users right now, pretty bad. So that's taking up a lot of time. And then we also, you know, tuberculosis is ways around. And if we have an active TB case, we have to go to the home and do directly observed medication for that person. And so we may be doing some of that for the near future, which again takes the nurse. And we're spread pretty thin right now. So we're super busy trying to keep up with that, as well as our server went down. And so we haven't had a computer Monday and Tuesday. So I'm not sure why I'm here today. It's not been a very pleasant week, to put it mildly, but we do have a new server. They are putting it in. The problem is our old server, he described it as it had so many Band-Aids that, you know, downloading the data, they're getting those little glitches in it, and then that's what's taking so long. So hopefully, if people are having trouble getting a hold of the health department, our computers are about half working. And so hopefully we'll get that resolved in the next few days, but it's been a real challenge this week.
Well, outstanding job of communicating this to the public, and just want to keep doing that. You know, we just want to keep getting the word out. and make sure people are being vigilant. I mean, I don't know if you have a pulse on things as far as you kind of like where we're headed right now, you like the trends, or if maybe the COVID is still one of those, gray areas. But it seems like to me, more and more people are being vigilant. And we need to make sure we're reminding people that, right?
Right. I think that, we do have quite a few people in the county vaccinated. However, we're not at the threshold where, just throw everything away, it's gonna be okay. And I have the numbers too. Just for an example, in January, we had 812 new COVID cases in Gibson County. In February, we had 144. So after Christmas, we had this big upload of cases, and then it dropped off in February, and now we went back up to 197. And so our average per day in January was 26, and February was 5, and then we went back up to 6.4 in March, and as of April, of course, we're still young with it, but we're over 6, almost 7%. So we're steadily climbing back up. So I think that's where, we really need the public, if you can get your vaccine, come and get it. Continue wearing your mask as much as possible, because we still have it in our community.
Sure.
So I think that's what we need to.
I've tried to ask as many people as I can, and just even strangers, what is your take on availability? Have you been able to find a vaccine? Have you been able to get your vaccine if you wanted to? And, a lot of folks that I think are maybe, my mom and dad's age range in their 80s and whatnot, a lot of them have told me we've had access to it. Some of them have got it, some of them have said, chose not to, whatever the case might be, but they said, we've had access to it. And that was a big concern of mine, is just making sure that people can get it. And hats off to your organization, because you guys have really been out there, hitting the concrete and making sure that this is available to people.
Right.
So I thank you for that.
And we are also doing the hometown program. So there is a program where they can call 211 and get on the list. And then we can work with the EMS, but sometimes by the time we figure out we have extra doses at the end of the day, we just don't deliver them, because right now it's 7, 8, 9 o'clock at night.
Sure.
You know what I mean? So we've just been trying to do that on our way home. Because there's not been a ton of them, or if I can, I have hired a new nurse, or she's just retired, and she's done from work with us. Not like one of us can leave and just run and do it. We do all the paperwork, we get a hold of them, they call somebody in. It's just easier, we just run and do it. We haven't had that many that we've been able to handle. So, but we are doing a homebound program too, for people that are truly homebound. If they can get to the fairgrounds, we'll go to their car and give the vaccine. So all they have to do is send somebody in or call, and we'll come out and give the vaccine. Okay.
Very good. Thank you for the report.
Uh-huh.
Mrs. Rahman, not to put you on the spot or anything, but I was just thinking about the senior center. You're here tonight to talk about it, but do you feel like your people out there have at least heard about the vaccines?
Absolutely, and Diane is on our board, and we work closely with her, we talk to the health center. And we worked hard to inform them, and that site that she was talking about, seniors would come to our office, we would get on that site and make the appointments for them. We've been very active in it, and we had to do that in the sense that we need these people to be out socializing again. And almost all of them have gotten vaccinated, so. Yeah, we're very proactive on that.
I appreciate your work on that. And for those that may not know Ms. Rahman, I just met her this evening, but she's one of the gals that's in charge of our Gibson County Senior Center, and does a lot to help our older folks in our community that are super valuable to us. So thank you. Thank you. Anyone else from a department need to talk tonight or share something with us? We'll go down to old business. And we've got the ambulance bids. I'll turn it over to Mr. Spindler if he's ready for it. And,
Thank you. Okay, I have received 2 bids. I'm assuming nobody's here to submit another bid other than the 2 that we've received. This first one is from Crossroads Ambulance Sales out of Middleburg, Indiana. I think that's what that says. Looks like bid amount is $183,810. David, you want to come up here? Help me interpret this. Yeah, okay, $183,810. That's with a $5,000 trade-in allowance. Without the trade-in, it would be $190,810.
Discount from the previous.
Yep, and that includes a $2,000 previous customer discount.
Stay here.
Yeah, let me make sure I can read this next one. The second one is from Fire Services, Inc. This has got an Indianapolis address on it. Bid amount is $214,620. And then a $4,000 trade-in credit. No, excuse me, that's a Chrysler Motor Company discount. The trade-in is $3,000. So after those 2 credits, assuming we do the trade-in option, it would be $207,620. Again, that's $207,620. I would recommend that the bids be taken under advisement and acted on at the next meeting.
I so move.
thank you. Got a motion. We have a second. Motion made, a second. All in favor, signify by saying aye.
Aye.
Under advisement and bring it up at our next meeting. Mr. Watkins, COVID medical leave.
Yes, at the January Commissioners meeting, it was decided to extend the COVID leave till the end of March and then revisit this. Currently, we have no one off on COVID leave. And in my thread with other counties, my email thread with other counties, I've not seen any that are extending the COVID leave now. So it would be my recommendation that we cease the COVID leave at this time. And if anybody would develop COVID, it would just be regular PTO as with any other sick time.
Well, I'll make that motion.
Got a motion made to discontinue the COVID leave.
So I hate to do that, but we've had it out for a year. So I'll second that.
And a second. All in favor, signify by saying aye.
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 Thank you.
Yes. Sheriff Bottoms, water softener.
Yeah, it was brought up about a month ago. To either repair or replace the water softener, and you had asked about the warranty, and I got you a copy of that. I'm gonna bring it back up and see what you guys fix it, replace it, or nothing, or whatever.
I was looking at what we had for plumbing in the jail account. It looks like we got plenty to cover it. The amount, commissioners, is $15,627.57. And then my thinking was is if for some reason this would get low and we need to do something about it, then we could, bring in edit to help the sheriff if needed. But my initial thought was to pull it from the plumbing.
Well, I think it should be pulled from their budget first. We make everybody else do that. And I know Tim's gets on a very tight, he gets in a crunch once in a while on that especially. And, but at this time, our edit funds are pretty super tight also. And I think you need to take it out of your budget for now, and then we'll revisit if we need to. And we'll keep our fingers crossed if we don't have to. I guess fingers, arms, toes.
Go ahead and replace it then.
Yes,
I believe so.
with the new one.
Thank you.
So
We'll put that to a motion, I believe here. Do we have a motion to
I'll make that motion.
approve that purchase of
Approve
the
the
water softener?
water softener.
Okay. Do we have a second?
Yes,
So motion made in a second to approve the amount of $15,627.57 for the purchase of the water softener to come from the plumbing and electrical maintenance jail fund. All in favor, signify by saying aye.
All right.
Chamber Director Patty Vanoven. I had the good fortune of attending one of Patty's chamber functions recently, and it was well attended, and I learned a lot from some small business owners, and it was a good time. I would recommend to any small business or anyone here to look into our Gibson County Chamber. Patty?
Thank you. Thank you guys for letting me be on the agenda tonight. I am here because of Heritage Day. And first off, here because I want to make sure it's still okay. We always come to the commissioners and ask permission to use the courthouse lawn, this county property, and we will make sure that that is still okay for you. And also, I sent to you guys a map of our parking for setup of vendors, and Marion can attest to this from not last year, the year before.
yeah, we always say last year.
So last year that we did it, in 2019, we had sections of parking around the courthouse, kind of quartered off for the vendors that wanted to set up during the day that are on the lawn. And that way they have a place to park and unpack. And then we close the streets down after the courthouse is closed for the street vendors to park. But I just want to make sure that that's still an okay thing, or have discussion on that. The previous year, we had 2 spots. I know that I came and asked for 4, which was a spot around on each side. But it's really up to you guys what we can quarter off for those vendors. So it helps out a lot.
Yeah, we did it a couple of years ago, and it did help. I mean, been involved when we didn't have it. And yes, it's a pain for those at the courthouse, but it's, the one day actually. And it really helped getting those inside, so they weren't double parked, they weren't blocking, because for many times we've had vendors come in and they block our employees in. And we literally at times have had to get the police department out there to get people to move their vehicles so we could get the other ones out. And so, I think it's, I looked at your map and I can't remember, you had by the parking lot, west parking lot, right?
And so there's just like 4 section on each side. So the one on the Park Street side, we wouldn't block the entrance into the inside parking.
Right.
So that I don't know who parked there, but officials parked there. And then each place in front of like the sidewalk that goes into the circle area. So there's like 3 or 4 spots there. I have a map to you guys.
Yeah, we take up 3 parking or 4 parking spots?
4
That's what I thought it was 4.
on each side. And again, if we want vendors to come, because that was one of the biggest complaints that we got is the setup, and we're trying to make it convenient for the vendor. If we want vendors to come back, if we want people to feel like this is a festival that they want to participate in, we need to make it so that they have an enjoyable experience.
And since the city changed the city parking lot, that has interfered a lot because a lot of them used to, because if they didn't have that much, they'd go over there and park and just, dolly their stuff in or whatever. And we don't have that ability anymore. And this really helped because there was a few of them, we said, you need to get your vehicle moved so somebody else can get in, but it was never a problem. And they're pretty good about it because they're used to doing this stuff.
Right. So again, I'm just asking for those 4 locations around the square.
I believe you have my blessing.
Yep.
Go ahead, Jason.
I was just gonna ask for a motion, giving them those 4 spots and usage of the courthouse lawns for.
Well, the 4 different spots that are 4 parking places.
Right.
There's 16
16
spots
spots,
total, yeah,
4 sections.
right.
So I'd ask for a motion to that effect, approval of the 16 spots and usage of the courthouse lawn, courthouse property for the Heritage Days.
I so move.
Second.
All in favor, signify by saying aye.
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 Thank you. Another question that we have that's been brought up is the security aspect that you guys have been looking into for the courthouse, adding security measures and stuff. The festival utilizes the basement bathroom, and if we have that security, we would not be able to utilize those because in our budget, we don't have the funds to pay a guard or anybody to man that. So is that going to be in place and an issue for us to utilize the bathrooms? We just need to know.
In all honesty, at this point, I don't think the security be in place.
I agree.
Because we've had to concentrate on the probation and that, although we're working towards it. But I honestly don't think by September it will be in place.
And
It's possible, it's possibility, but it's slim possibility.
Is it okay that we utilize the bathrooms? I mean, I know we pay custodial fee for that, so I just want to make sure.
You pay one of our employees or a couple of them, didn't you?
Yeah, they clean the bathroom.
Yeah,
During the weekend.
yeah.
I would recommend that you keep all doors except the south basement locked like we're doing currently, if you're gonna grant permission for them to use the restroom.
I don't have a problem with that. I mean, it's gonna be a pain for some people.
So the south entrance.
So the south entrance, just like the courthouse is functioning now with only the south basement entrance.
Okay,
Of course, that's from both sides, but
that's fine. And we will have people walking, like volunteers, making sure that there's nothing happening down there, but we can't actually hire somebody. And the last thing that I have is we are having a welcoming on Friday night, and it is a county event. We'll make sure that that's very clear to our community, this county event. And we invite any of the commissioners, if they would want to come and help us kick off that celebration. It is, last year would have been the 40th year for the Heritage Days, and since we didn't have it, this is going to be our 40th year. So we're planning on marvelous things to happen, and we would like the commissioners to be a part of that, or any county elected official who would like to come out and help us celebrate that at 5:30 on Friday. On that Friday night.
on that Friday night, not this
Friday.
Friday.
Be waiting a while.
Be there.
So that's all I have, and thank you guys for your time.
Thank you.
Thank you.
Thank you, Beth.
Go ahead and approve, if you're willing to do so, usage of the basement and access to the building through the south basement entrance.
Also move.
Second.
All in favor, signify by saying aye.
Aye.
Aye. Thank you. Next up, we have the Fred Keister and the Straub Witten property, a request for a subdivision review ordinance waiver. Mr. Keister?
Warren, before we get started on this, I would like to make a motion to approve the appeal, not waiver, to the subdivision plat presented by Mr. Keister based on a review and the Harrison Monument being referenced, which is the monument in question. And to me, the issue at hand is the plat itself, not the section corner. Commissioners have no say on section corners. But that is the perpetuated corners is done by the county surveyor by Indiana code. But I'll make a motion to approve the appeal.
And your motion is to approve the appeal for a waiver of the subdivision control.
Well, there's a difference between appeal and a waiver, but an appeal. He appealed to have the plot accepted. And I make a motion to approve that appeal.
Second it.
And just to make sure I'm clear, and I'm not trying to give you a hard time.
No, that's fine.
Okay, so you're making a motion to accept his appeal.
His appeal on the plat itself.
Okay,
Yes.
Okay. Thank you. Well, we got a motion and a second. Is there any discussion?
I don't have anything to add to that.
All right. Mr. Spindler, any discussion on your part?
I don't believe so.
I've got a motion and a second on the floor. All in favor signify by saying aye.
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 Thank you very much.
Thank you. Thank you. Gibson County Comprehensive Emergency Management Updated Plan. I believe everyone's seen a copy of it.
Well, and it doesn't need to be approved or anything. We just had to sign it, which
Okay.
I did before.
Okay.
They did too. So it's a report that has to be turned in every year. They usually have to make a tweak or two according to what the state requires. And it's just something we do every year. We have to have the plan established for the state.
I'll move on to new business then, unless there's something I need to tie up there. Bill Tooley had contacted me and was going to come tonight, but he's unable to make it, and just want to keep him in our thoughts. But Mrs. Rahman, you're here this evening, I believe, to address this. Would you like to come up to the podium, please?
Okay. Here, Larry's on our board of directors, Diane is, James Levin, I did put a little bit of information together. And understand a little bit more about you.
Welcome, all of you.
Thank you, Laura.
Welcome.
Thank you. Warren, Shannon, and Mary. I started with just a letter just explaining a little bit about what we do. I think Dan's been to our building, but since I've been there, we've got this money to bunch of seniors. And with COVID, we feel like it's important to give them a recover
Right.
and socialize. We've seen a lot of behavioral health issues and we're going to get out. We've worked hard to bring an activity person and we started some meals twice a week. And since so many were vaccinated and the health department looked at our facility and serving the meals, I think we're doing pretty good. But the situation is if you, as a county commissioner or county council, came across some recovery money in the future, we were just asking if we could have a donation, and I'm explaining in the letter a range of what we were hoping for. And the reason is that we worked hard to get bring in money, and I explained there the city, the county council gives us a donation, but we never have been able to accumulate in our building fund some of the things that we do. And I think Larry would agree, and Diane, we just gotten behind, and in the last 2 years, we're trying to catch up. If you ever have a chance to come to the center, we'd like to show you around. We have a big dining room area where we do a lot of activities. And James, who is in our transportation department, manages that. We have vehicles and drivers that take people to medical appointments, and we do it for every, the whole county. Like, our big thing is we try to get everybody to their dialysis appointments. James, how expensive, like, we pick up people from Princeton, and what are the other counties pick up people from that?
Mackey, Somerville, Fort Branch, Oldville, pretty much everyone.
And we work hard to include everyone in the county for everything we do. Like the sign up sheets, you would see names from Topside, Patoka, Fort Branch, and, that's part of what we're, trying to do with our rebranding and the effort. We're trying to make the place a very welcoming place and safe place for seniors. And, well, I guess what we're asking is just help with our building fund. So the two main problems we're having now is the HVAC, system is just not working well at all. And so I have talked with Mike Sokolin for quite some time, and the board members get, help with just having those conversations. But I explained in here, and you can see it in your paperwork, there's 6 units and hardly any of them are really working. And then when we do have a couple units working, they're so old, just in the last 3 months, we spent $6,500 on our electric bill. And when you're not for profit, that's really hard to do. And then the other thing is the parking lot, and Larry and I, we've had to get some bids, but I gave you guys some pictures. The parking lot is just really, in poor condition, and we'd like to get some work done on it, to pave it. I was telling Larry, somebody was coming in the building yesterday, and even though we got all these nice handicap spots, they trip. And it's just not a good situation. So, basically, we're just asking that if you did come up with, COVID relief fund, if we could be included in, and maybe using those funds for our business one. If you ever have any questions, let us know. We'd like to give you a tour of the building. And Bill did want to apologize that he couldn't make it. The other thing I included is just an idea of last year on how many rides we did give in the transportation section. I mean, if you have any questions, or if you ever had any time that we could give you a tour. Or what you thought. So just let us know if you could ever help with that, and that we're just making money for a one-time amount.
Did Mr. Sokolin act like that we might be able to go with a more modern system or modern HVAC that maybe you wouldn't have to have as many units, or did you even get into that yet? Maybe.
We have talked about this because last year we had a little bit of money where we could repair a couple of them. And then this year we did another little repair. The new units he's gonna use, and he's talking to James some too, they're gonna be so much better on our electric bill. And we even, like, to help with our electric bill, we had LED lights put in, and all we had to do was pay for the lights, and the electrical union did all the work. So with these HVAC units, Mike seems to think that this is our only way to go. They're gonna be much more efficient. But with the ductwork that's there already, this is the best we can do, are these new units that he wants to put on the road. And there's 6 units, and how they are put over the building, I think we're gonna have to go with 6 units. Just by how much space they need there. And, I mean, if anybody wants to chat with Mike, we have kind of limped along. He's kind of limped with us, and, yeah, it's just a building that's gotten behind, we're just trying to catch up.
I know Bill told me that he was actually taking parts off of one AC unit, and putting on another one so they'd have one that worked.
Yes, yes,
So-
and now we're down to where 2 really don't.
Yeah.
Yeah, and it's a shame because your heart goes out to the seniors who are in that big room. And I mean, I know we had a snowstorm, we had COVID, and it's like, the building is not warm in the winter. It's quite sad. And with everything they've been through with COVID, we're just, if you come out of the building, you see that we're just trying to make it very welcoming, very caring, and need a warm building and a food building.
Yeah.
Oh, sorry, go ahead, Mark.
Well, I was just saying, I don't think a lot of people realize how much the senior center truly is used
Oh,
for
yeah.
many different things. She included some of the, calendar work, and I know a number of people that go there virtually every day and have missed it through all this.
Oh, yeah. It's something.
And so, I think some people just think, oh, it's there, nobody's ever there. And that's not true.
Right. And in fact, I was talking to somebody today, as, in the next couple of months, we updated our stage a little bit, but we got a lot of volunteers helping to change that part of thing. But soon, we'll have a couple groups coming in and singing after lunch, or participating and stuff like that.
I know the chambers utilize their area as well too.
Yeah.
It's a great area and, I mean, they do welcome the community in as well, so.
Thanks, Ben. Yeah, we try. Yeah. I mean, like the transportation department, sometimes they have to just move out of their department. No air,
That right?
no air, nothing.
I tracked those units back to about 1990.
Yeah, we gotta do something about that. We gotta do something about that.
That building was built, I know, before 1983, or I know that is because we had our wedding reception when the wedding went in. And that's where we had it. So I know it was built before that.
And it's probably originally.
Yeah, they were actually
Well-
set on the ground and then moved over onto the roof. And like 79 as far as I can go back.
And the last thing I'll say is we've had some water leaks. We thought maybe there was an issue with the roof, maybe that some patching or something. The HVAC unit has rusted through so much water's coming through the HVAC unit. So that one's shot, you know.
Well, I mean, it's something we need to look into and see what, can qualify for, maybe with some of this new money we're getting. We don't have all the parameters on that yet.
Well,
And
we
we're
appreciate
working
it.
towards it.
And I know the next guy we do some asphalt work, Larry, and I can talk about, get some quotes on that. And if you come by, you'll see, it's not smooth by, we're kind of losing the base and everything to get into place.
Well, you need, and I realize this, to prioritize because,
I understand.
money's gonna be tight on, on getting things. And so,
Well, thanks for your time.
I might add one last thing before you leave. You might want to look at, get an estimate on some insulation too. I don't know if we could insulate that ceiling or if there's something that could be done there, but,
It's been very difficult.
is it an open ceiling?
We talked about that, we have to move a lot of panels and maybe it's spray foam, but the price would be pretty.
It's a concrete. It's all concrete up there.
Uh-huh.
Sure. It'd have to be sprayed foam.
Have to be sprayed in.
And we can pursue that and get an estimate, but we still need, some of those units aren't working at all.
Right.
See, that's one of the things, like Mary said, if it's on our to-do list,
Right.
so that they get insulation after HVAC and some other things.
Gentleman over had his hand up.
Yeah, that building is utilized by the entire county. I know Dakota Township gives you a donation, they better be still giving you a donation.
They do in the fall, and I put in the letter some of the people that do help out work.
We were in there, we suggested to them also to go to the other trustees in the townships and maybe call a meeting, have them all come in and go through what you guys are going through.
Yeah.
Because they all have people that are in their areas or their districts, they're going to there and utilizing it, and it's well within the purview of a township to give donations to something like
And you
that.
can pursue that.
good suggestion, Bruce, thanks.
We're definitely gonna put you on our list.
Well, we appreciate it. And like I said, anybody wants to come by, I think as a commissioner, you want to see what we do. And,
Sure.
there's a meeting, if you want to come on out.
Well, thank you.
Thank you.
Thank you very much. Appreciate it. All of you that came here tonight for the senior center. You folks are angels looking out for the older people in our community.
We're gonna be there one of these
I know,
days.
I know. I want to see this thing kept going because I'll be there too, right?
Yeah.
Geez. Thank you very much. Moving on through our schedule here, major medical leaves.
We have 2 major medical leaves that all paperwork has been looked over and is in order. That needs to be signed there.
Do I have a motion to approve the major medical leaves?
Also move.
Second.
Got a motion and a second. All in favor signify by saying aye.
Aye.
Aye. I may let you guys take care of if you want, and I'll get in here in a minute. Next up, State of Indiana Mask Advisory. Many of you have heard already that the advisory that the Governor Holcomb has issued is a mask advisory. It requires mask in government buildings. But it is an advisory. Requires the mask in government offices and advises the use of masks in public places, but it's not the mandate like we've had before. So the way I understand it, and I want you folks to chime in or to collaborate on this if you have anything extra, but the way I understand it is Governor Holcomb has released the mandate, so to speak, and now has issued an advisory. And so I think we probably need to address it. I know Vanderburgh County recently adopted the advisory from the state level. Mr. Spindler, do you have any thoughts on that, or do you have any, thank you. Any news, or have you heard from any other communities in our area? And Diane, feel free to chime in too here.
Well, I tell you, you'll notice I'm not wearing one. It's the first time of year I've actually put my hearing aids in without jerking them out every time I take a mask down. So I thought, it's gonna wear them tonight.
The health department, I sent information to the board and Dr. Brake. And obviously, with our numbers going up and not down right now, you know, we still would appreciate if the community still wears their masks because they do helpful things. And so that was the health department's request, is that even though it's not a mandate, we still recommend that you wear your mask when you're in public, especially in large crowds. I noticed some pictures that was in the paper, like at the Easter gatherings and stuff. There were hundreds of people together and nobody had masks on. And, you know, we'll wait and see how our curve goes up from that. I know Monday and Tuesday our numbers were up, but they do make a difference. So, you know, it's the right thing to do. We know that it's the right thing to do. And so we still recommend, we strongly recommend that everybody continue to wear them as much as possible when they're around other people.
Okay.
I know there's an event going on this weekend on the square, the craft show. I don't know if that's in consideration with anybody with that.
I think Diane's getting blown up with what's the county going to do in response to Governor Holcomb from various events. And I think when we take action tonight, whatever that may be, we need to address the checkpoint in the basement of the courthouse. She's been manning that, staffing that for months now on very limited resources. Both judges have provided some input on that. And I would recommend that the screening be lifted and that whatever the judges deem appropriate is what we'll do going forward. So if they're going to have a sign-in list down there where people entering the building sign off on they don't have COVID-like symptoms, essentially just I would recommend delegating that to the judges, what requirements, if any, for entry into the courthouse, but nobody there from the health department manning a station.
Well, I know when Diane and I had talked, North Gibson went on spring break week before last, right? And South Gibson was on last week. I'm not sure on East, but I know it was one of the two. And we've had Easter. And, you know, I think we need to follow the state mandate and however you want to word it. But as far as, to me, the only thing we need to decide is, do we want to carry the courthouses, the county buildings having masks for the next 2 or 3 weeks because of, I know a number of people that went on spring break vacations just as a precautionary. And we have to remember, we had the NCAA in Indianapolis, and we did have people that went up to that. So, I mean, in all the past, we've stayed with what the state has said. And I wouldn't want to take it out too much further because I'm tired of wearing them just like everybody else. But I mean, in certain circumstances and that, I know I'll still put one on. But.
Well, I've had COVID back in July. And then also I've had my vaccine, my Moderna. And so I'm at the point now to where I'm kind of doing this, I think, to help other people. That's my intention. You know what I
Well,
mean?
yeah, I've had mine too. I've had mine for quite a while. And, I don't feel like, for me, myself and I, that I need it because of it, because that's what we're hoping this vaccine does. But like I said, encourage people to use it because we still have a lot of our population that has not had, at least the full dosage now. But as I was telling somebody, we're about at the size of the population of Princeton. So we got the whole rest of the county. So to me, it's, do we want to put it so that, for however long in April, people still wear it in the county buildings. But I don't feel like
I like
just
that.
like we did in the past,
Right.
we said everybody else, you have to go by the state.
I like that idea. And I also think, within our county, you're going to have businesses that will require people to wear a mask.
Mhm.
And I think, I just want to put this out there to the public that, it's like I told you my own personal story. I don't think I'm doing myself any favors right now, but I'm doing this to help other people feel comfortable. And I know I've got friends, one good friend who just had open heart surgery. And I know, he's worried, he's very worried about it. And so I do this for other people, and I hope that's something we all can get behind, right? We all can get behind and realize we're doing this to help others. But at the end of the day, I think we also need to know, given the governor's advisory position, that we're going to have businesses just like we're doing here with our county offices, like you said. We're going to have businesses that still have their signs that say, please wear a mask or a mask required. And, we want to encourage people to understand it takes a team. We need all Gibson County to get behind this for as long as we can and look out for people. If they put that on their business, then we're asking people, or I'm asking people, to respect it, to observe it, and to show some patience, right? I mean, we've all learned throughout this trial and tribulation that we've had to show patience, right? With ourselves, with our families, with our neighbors. My kids were cooped up forever doing, we called it the COVID homework. But they had to do all their work at home when school was, out of session stuff. And just now we're starting to see a little bit of light, aren't we? I mean, we're starting to see some normalcy return to our community, and I just want to see that continue for all ages. So, I mean,
Well, and I think too,
I don't know.
what we was talking about with the senior citizen center, a lot of the seniors don't feel comfortable going places where a lot of people don't have their mask on because they have so many health issues, or they've watched so many of their friends pass away from this,
Mhm.
So I think it's more of a respect thing for the community, is for us to continue to wear our masks. For the people that maybe have some concerns or have, your cancer patients, some of them, the vaccine doesn't work because they're cancer meds. And so we need to protect them too, So it's something that you're doing for the community. I'm the same way. I'm vaccinated, I probably don't need to wear it. But I want all the people to feel comfortable And I do think it does help quite a bit. We've not had near as many sick kids in, in the school system with other issues as well in the workplaces. So it has its benefits. And even though it is a hardship at times, especially when you're in big crowds and in confined areas, that's when it's really important. The population that you're not familiar with, and you're in a close area with poor circulation, that's real important to keep your mask on.
Good points. And the other side of the coin is, and then I want to take Cecil, the other side of the coin is there may be some places where they don't require a mask. And I think those people that want to wear a mask and be around people with their mask you need to be conscientious of that. You need to understand it and realize that may not be your hangout, right? It may not be your place to go. And so there are two sides to the coin. And I think we all just need to be understanding of one another and practice good hygiene, take precaution, and stay vigilant.
I agree.
Cecil?
What the governor said about raising or loosening up the mask mandate, it struck me kind of funny. He said he's going to leave it up to everybody, but yet it's mandated in the state buildings. All in all the state buildings, it's mandated that you wear a mask. But everybody else can just do whatever they want to.
It's also, I have his recommendations right here.
Yeah.
It's also mandated in the school systems.
Yeah,
And it would be in all our COVID testing and vaccination sites
but
also.
if you look at what happened just over this last week in Texas, there was a ball game with 40,000 people there. You had spring break not too long ago. You had over 2 million people flying for Easter vacation. And you're going to tell me that we're not going to have another surge of COVID in this United States? I had a little girl, probably 2 or 3 years old. I was in the gym. I wear my mask in the gym. And she said, "Mister, why are you wearing that mask?" And I said, "Because of you." And if we can't think about other people, there's nobody in the world hates wearing this mask more than I do. But it's something we got to do. If we're going to save lives in this United States, we got to wear a mask. We got to keep people safe. And so for us to do away with wearing masks and get the gang, I think you guys are doing it wrong. Don't even think over that way. But we're just doing it for other people, not for us. I got all my shots too. I've got both our shots too. We feel like we're fine. But I still wear my mask out in public. But I don't do it for me, I do it for the public.
The jail will still be requiring it. No matter whether.
Good.
It'll come back.
No matter whether it's recommended or mandated, we will keep burning the jail until further notice. Because, we've got staff people, we went almost a whole year fighting that stuff, keep it out of the jail, and it finally got in. And those people in the jail, inmates, don't have the option of getting out, going to the doctors and this, that, and the other. We've got medical staff to take care of that. We're gonna do what we can do to keep it out further. So just for information, we will be required, anybody that goes into the jail, will wear one.
That's good. I stand behind you on that.
The other thing is, for people to consider, even if we ask them to continue wearing their masks for a short period, the more people we get vaccinated, the more we'll be able to loosen up with these masks. So again, we need people, we need the whole community to get the vaccine. Not only for themselves, but to protect our community so that we can open up and not have big outbreaks and have to shut things down.
All very good points.
Well, I guess, the point with us is what, if we're going to mandate it in the county buildings, are we gonna set a time period? Are we gonna say, leave it there and then we'll tell you when?
I almost thought we should do it from meeting to meeting. And maybe that's too short notice, but I almost thought we ought to check with Diane every meeting and see what the numbers look like. And the state's telling us, or the state's, doing the advisory, right?
Right.
So if we were to go with the advisory and just follow suit with the state, which I think would help people, and in one regard, I think it would help get everybody on the same page.
Right.
Everybody knows what the guidelines are. They can't say, well, I'm doing it here and doing it there. And here's the thing, if I think about just myself, well, I know where the mandate is, I know where it's not, right? But there's gonna be a lot of people that aren't in the loop. And so that's why I think you need a common language and a common rule. And that's why, I think in that advisory position, they put us in line with the state in Vanderburgh County. Now, that said, and tell me what you think on this, Mary, or anyone. I think the minute we see, if we see a dramatic increase in cases, the very next meeting, we may end up going to a mandate in our county. God forbid that happens, right?
Oh, yeah. Well, and the thing is like Diane said and Bob said, there's people out there through all this that has never put a mask on. Now, they haven't been able to go to certain places, and you just have those people. That's all there is to it. And, with the advisory, okay, we're gonna try to loosen up, we're gonna try to get back to normal. And I think just about everybody here could agree, we hate these things. And Diane, that's Diane's profession. But, we have to start trusting people. We're gonna have people that are still gonna argue at some of the businesses that say, we don't care what the state says, you wanna come in here, you don't put a mask on. And they're not gonna like it. Well, it's your choice. Put it on or don't put it on.
Right.
If you don't put it on, you don't go in. Same thing to me with, we say county buildings, you have to have them. Don't have one in, we can ask you to leave. But also we have to give people, okay, we're gonna say you don't have to, but we really feel like you should to protect yourself, your family, and your friends. And in all honesty, going through most of this, did all of us really put a mask on because the governor told us we had to? No, we put it on to protect ourselves and our families and friends. And I think people will continue that. And I think there'll be some businesses that are going to lift it. And there's going to be some that won't. And we just have to use our head and our common sense and faith in people that, they'll do what we need to do so that we can get back to not wearing. I'm not looking forward to wearing this another summer. Let me tell you. Wasn't too bad this winter, it kept my face warm.
Just to clarify that, then, if we're gonna keep the mandate for the courthouse, then you.
County buildings.
So do you still need that, or staffing it? Because we're the ones giving them the mask.
Do you think,
Just put the table, just put some on the table.
I will say put some on the table and, to me, if the judges think we need to have somebody down there, then like, I don't want to get Jeff or Rob mad at me, but it's like, okay, find somebody to do it. The health department is totally overloaded, especially now, especially since you're trying to go out to the different places to be able to give the shots and stuff. that puts an extra strain on you guys from what you've been doing already.
Diane, I'm not gonna make any friends by saying this, but maybe one person from each, they could even rotate. One person from each office up at the courthouse. could-
Yeah, I don't know if you're gonna get that done, but,
They tried that before.
they tried it before. We tried it before.
Over like a lead balloon, I guess.
Yeah, yes.
All right,
We do have lots of masks, though, if you do want to leave them out there, we do have a lot.
here,
We'll finish up this week,
Okay,
here you have,
and then I'll give you
Okay.
20.
So if you need to leave masks.
well, give the judges time to decide if they think they need to do that or how they want to do it.
I think it's gonna be a sign up sheet.
could you communicate that with the judges or
And I know there's some of the employees at the courthouse
that with the judges or one of them?
aren't real thrilled that we're going to be doing this, but there's going to be a number of them that are going to be very happy we're doing it.
Yeah, that's
By her or by us.
Well, the thing is, we do have other barriers in place at the courthouse. And every office has their door, barrier and stuff. So, we do have other things in place to prevent it. So,
Do we have to put it into a motion?
we put that in motion, Jason.
Yes, I
Yeah,
would.
did you want some, Andrea?
I just wanted you to clarify what you're saying. You agree
Yeah.
with the governor's advisory, but he's
But
mandating in state buildings, you are mandating a mask
we're
county.
in county buildings.
All county buildings and the
That
jail.
mean I gotta leave?
And going forward till we say otherwise.
I'll leave.
I'll make a motion that way. And I know Kenny won't second it.
No, I want to wear my hearing aid.
Are you sure you really want to hear people that badly, Kenny?
I can hear you better.
Okay. So do we have a motion?
Yes, I'll make that motion.
Okay. do we have-
Was that clear enough, Andrea? Okay,
This is for county buildings.
for county
Yes,
buildings,
sir.
for county
Okay, I'll
buildings
second.
only.
Mask mandate in county buildings.
Yeah.
Yes,
Advisory everywhere.
advisory everywhere else.
All in favor, signify by saying aye.
Aye.
Aye. Thank you, and thanks to everyone who provided input too.
Can I leave now? Since I don't have one on.
I got one out in the park, and if you.
I got one at my truck.
Warren, can I ask for a motion to relieve the health department of manning the station in the basement at the end of this, upon conclusion of this week? And then delegate to the judges and myself the policy going forward for entry. I'd ask for a motion to that
Well,
effect.
as far as how we're gonna,
Yeah, they're gonna want a sign
Maintain
up
it,
sheet,
yeah.
I think, just checking off that you do not have symptoms, and then if you do, you call the applicable court. So I imagine that's what it's gonna be, is a sign in sheet saying you have, by signing in, you're acknowledging that you're not symptomatic. And if you are symptomatic, then you call circuit or superior court based upon which court you're in. Yeah, I think that's what they're gonna want to do based upon the
Okay.
emails that I've received.
okay,
So I'd like a motion to that effect, delegating those decisions to, again, myself and the judges.
and that's how should we word that, it's the monitoring? The health department will monitor till the end of this week,
Yes,
and moving forward, then it will be to the discretion of the judges and the county attorney.
yes, I like that.
David?
Well, you think that, I'm not trying to drag her more into this, because of the fact, the judges, there's a judge, but do you not feel that maybe with advice from the health department, that the judges should be getting some guidance from the health department on what they do there? The only reason I mention this is because she's not listening to me, like, I feel like I'm got my wife here now. But you see what I'm saying?
No, I understand what you're saying.
I'm not trying to knock anybody, but I think it'd be a good idea to have the health department having some sort of input along with the judges so that they can guide them a little bit on what they need to do. That's just my thought.
As far as like their sign up sheet and then the precautions they take.
The health department may think about what they want to do I know what you're doing right now with the mask. But if anything else that, you know, I don't know if they've got any other ideas that would help, you know, guide this or not, and I'm not trying to throw more on you, but what I'm saying is, I think that the health department, since they are the health part of this, that they ought to, I just feel like maybe they ought to have some say in this too.
Sure.
But just a thought.
No, and I agree. And
I mean, well, and I don't have a problem with that, David, but I also know during a lot of this, the courts did get a lot of, I don't know how, rules and regulations, et cetera, through the state judicial system. And,
I don't know where they're getting it. Again, I'm not.
No, I understand.
Well.
well, inquiring minds wants to know if Diane would be willing to help them make, you know, the decision, or something comes up through the state health department that say, hey, you know, they're suggesting this, then he can let them know.
And we have weekly conference calls with the District 10 nurses as to what's going on in the 10 surrounding counties, as well as twice a week calls with the State Department of Health. And so, you know, I can definitely get some input from the epidemiologist too. So, yes, I can get all that for you.
Hang on just a second, Bob. Do you have a problem with, don't you think that would be okay? Add the, you know, added advice from the health department?
Yes.
Yes.
I guess I'm a little confused now. You guys are making a mandate that there will be mask worn in all county buildings. But then you're saying, we'll wait and see what the judges say.
That's just for entry into the building. Instead of going through the checkpoint right now where the nurse checks you out or the health department staff checks you out,
Yes.
probably going forward, they're going to be signing a sheet saying that they are not symptomatic. Can we leave the temperature check up there, or is that a?
So, yeah, that's.
They'll still have to wear a mask, Cecil. Though.
I was gonna say,
No, they still do, yeah.
Still have to wear a mask.
Yes,
But anybody else said,
right.
you still gotta wear a mask inside that building.
Right.
Regardless of what the judges say or not.
Well, what we're going at with the judges are they can, you know, they have people coming in. Are you, you know, we want you to have a sign-in sheet. Are you ill or whatever? And they say, no, they're not ill. Then the courts has that record.
And I'm gonna be honest with you guys. I've been in the courthouse, I don't know how many times, I ain't never signed dining.
No, this will
Well,
be.
no, this would be new. We
This will be
haven't
instead
had
of
one.
the health department.
Yeah,
Yes.
yeah. Yeah, no, we never had that before.
They take my temperature. They take my temperature, but I've never signed anything for it. I just walk in, set my temperature and go on and do what my business.
Right. Yeah, no, we never had sign-in before. This sounds like this is just a suggestion, possibly coming down from the judicial system.
Be tracing. Who?
My question
More or less.
What's the sign-in sheet gonna do for you?
They're signing, my thought is they're signing off on not having symptoms. That's what the health department's doing right now. Do you have these symptoms? Do you pass the temperature check?
Right.
So instead of having that, they're signing off saying they don't. And they're going ahead and checking their own temperature without the nurse monitoring it or the health department monitoring it. And then they're grabbing their mask if they need one. And the reason why, as Mary was mentioning, the judges are so important to all of this is because at one time, all of the judges had to submit a plan to the Supremes that had to be approved. And that plan that was submitted required the plan that we submitted or that our judges submitted required the nurses stationed downstairs to help.
What do you want?
And other regulations. So we want to make sure that they're comfortable with whatever changes are made considering that.
Steph, go ahead.
So you have your sheet, who's going to collect the sheet, and you also have your HIPAA laws, your privacy. So can't just leave them there laying on the table.
Well, I don't think it'd be a HIPAA issue if they're disclosing they're not symptomatic of COVID symptoms.
They won't put their name on there. So who's going to collect those sheets?
Probably floodplain administrator.
I would say, because this would be a judge's thing, it would be up to them to produce the personnel to do it.
Yeah, we'll have them collected. I'll have them collected at the end of the day.
You know.
Yeah,
Their court reporters.
I totally understand.
I know we had a motion there going and,
Lost some steam.
it was for all the secondary stuff, but, did we have an actual motion from anyone on that? I know there was discussion
Yes.
about a motion.
Yes.
Could you please restate the motion for the record?
Oh, geez. Didn't you write anything down, Michael?
I wrote it down, but there's too many extra notes, so.
As far as I'm concerned, the extra on it is that with the advice, would that be a good word from the health department? Guidance, advice, whatever.
All right, we've added that, information about the health department providing advice and guidance. And do we have a second on that motion?
Yeah, I'll second it.
Okay, motion made, a second. All in favor signify by saying aye. Aye, very good. Southern Hills Crossing, I believe, Mr. Phil Reinbrecht's here with us this evening. Mr. Reinbrecht, would you come forward to the podium, please? Good to have you here.
You guys get your copies. Did you get your copy of the plan?
So,
Go ahead if you got something.
yeah, I mean, I don't really have a lot.
It's in the office.
I believe that, we have all the information I presented it to the president of your committee to move forward with, Southern Hills Crossing subdivision. That's why I'm here, to make sure that we met all those criteria and that we can, move that process forward.
Well, as far as coming to us at this stage, it's a little early because we don't have, anything from but we are aware that you have put the plat in, the surveyor has given us copies of it. But we do not have any results from the committee on it yet, because it was just submitted.
I thought that they had, I've talked with them. I think when I talked with them about it, there were a few issues that had to be addressed. I think those were resolved. And
We met, probably 8 months ago, maybe longer. Some visitor committee, and the only really outstanding issue was pertaining to the septic system.
Yeah.
And we've met with, Ben Dye, and he has approved what we have, we submitted everything to the state to get those approvals. And he has told us that he is good with everything as submitted.
But he has not gotten approval from the state yet.
He already has the approval, yeah, that's what I was.
Oh, I was told that he doesn't.
Yeah.
And he has submitted everything, but he has to get everything back from the state in writing, and I don't think he has it. I don't think he's gotten it back from the state yet.
Several weeks ago.
Well, that's my understanding too, the same as Mary. But maybe there's just some lack of communication we can look into.
Yeah, I'm not sure.
I'll call him real quick and find out.
Well, but we don't have the approval or anything.
so
Signage from the surveyor's office
You
yet.
want the written information from the state?
Yeah.
I'm gonna say, I know what you're talking about in the septic issues and stuff. And I know who showed me that, but I have not seen anything from the state yet, so.
And that's my
Maybe he
understanding,
just-
that's my understanding that he does not have the written.
information
From the
from
state.
And he
Yeah.
may, I will find out tomorrow, and if he does, I'll get that to you guys. But,
Well, it needs to be Ben needs to get it to the surveyor's office.
surveyor, okay. But I have not seen it myself, so, but like I said, our computer system's been out for a week
Right.
now, so, if he's waiting to get something from the state. it may
Yeah,
be-
well, that is my understanding.
It's gonna be in there somewhere, but,
Well,
had some major
yeah.
computer issues, so.
Well, to me, it's like, okay, Ben, get on the phone, tell them, oh, we have to go snail mail because our other mail doesn't work.
I know.
Phil, just wanted to run this past you, and I'm not even providing this option. I want to be clear about that. But I'm just trying to brainstorm some ways to help you with this development. And I'm fairly familiar with it, having done research of the area and involved in some prior meetings with you. Would Rybrook Homes be interested in utilizing the county road to run sewer? How far are you from city sewer where you're at?
I don't know the exact figure of how far, but
Would you say a half a mile or not that far? I mean,
it's probably a little bit farther than that.
a little bit farther?
It's the nearest junction that I'm aware of is that.
Well, I did get a
County road
report.
that runs down to the railroad track,
Uh-huh.
and then, the intersection.
Still waiting for them.
Maple Street. that's
As,
Maple
as
Street.
far as Ben.
Um,
I was just trying to think, I know you ran into some trouble there with getting the easements and whatnot, but the county road's an option to be looked at. I'm not saying it is a true option at this point, but I just got to thinking about that. I mean, let's face it, septic systems are very useful. My family's used them. We've put them in for years. That's how I paid my way through college. On Saturdays and Sundays, putting in septic systems around Monroe County. Make a little extra money. But ideally, it'd be nice to be able to tie into some city sewer, right?
Yeah, I mean, that would have been a really good option if it came up about a year ago.
Yeah.
At this point, we've already done all the engineering, spent all the money to get the layout we've got now. We originally were shooting for 72 lots, we're down to 40 now based on the system. And like I said, I was pretty certain that Ben had already got the approval, that I wouldn't have been here tonight. But we're proposing to put in a commercial grade septic system.
They're sharing it, right? These
Yeah.
people are gonna be sharing a septic system.
They're sharing a field bed, so each lot would have its own tank. But all of those would tie in, actually, it's like 3 different beds. But yeah, it's all a community system that, it would all tie into. That's the system submitted. And like I said, everything I heard was that we were good to go at the state level, so, and Ben told us that, and Becky was also involved, with the sampling and all that stuff. We did all the soil samples that were required.
Well, and the thing is, from what I'm understanding, Ben sent it thinking this is good, we don't have a problem. But as we all know, you don't necessarily get quick response from the state.
Well, like I said, we submitted that back in the fall, so it's been a while. Like I said, I got communication, it's been several weeks ago, we were all good with that. Because since then, we have actually hired an engineer to do the final drawings. We got the parameters of the system approved, is what I was told. And the last thing we needed was simply the physical layout of those parameters on the line. So there's 2 specific lots, the field that has. And that's what we have to finalize the drawing on. We've already submitted that to the engineer to get that up. Well,
I'll make sure to reach out to Ben. But I'll be honest, I've just never heard of sharing a septic system.
yeah, it's actually been recommended. It came from him. It was something that he's seen before. He was the one that brought it up, and that's what this whole thing. We were planning on doing individual field beds on each lot. And he said, hey, this is probably a viable option for you guys to get a better system. So
It was brought up at one of our state trainings that,
Is that right?
yeah, subdivisions are going to that. One thing, the problem that you have when you have multiple people in subdivisions that maybe didn't deal with the septic, they don't know how to take care of the field bed. And so when you have one that they're paying like an HOA fee or something on, then you have a caretaker of that.
Is that how yours is gonna be set up? Sorry to interrupt.
absolutely, yes.
Okay.
Our plan is to set an HOA, but they're going to get these that will report that to take care of it.
Okay.
And I have, I've seen drawings and stuff of this. I'm just not exactly sure which paperwork you're wanting. And so I know that, yes, we've been working on this with them for a long time. So,
Yeah, we've done this around now for almost 2 years.
Okay.
But I don't know exactly which paper, if we have vaccine stuff come through and we submitted stuff to the state. But I don't know if I have an actual.
I'll reach out to Ben too, because he's always good about getting right back with me.
Yeah.
And if he has the state approval on it, then we'll know.
I just sent him a text. Let me try calling him. Just, you go ahead and continue and see if I can get some
My
information.
question to you guys, what is this process look like moving forward? I was under the impression that we bring it here, we can go ahead and do those notices, assuming that we get approved, but.
We have to have the signed plat from the subdivision committee. When they do that, you bring it and we approve it.
I was under the impression through our engineers that that's already done.
I'm agreeing with Mary on that. You have to have the health department approve it, which sounds like you're going through those proper channels. Then a subdivision review committee, and then the final say will be with the commissioners, is the way I understand it.
Right, right.
That's correct, after a public hearing. So I thought that Health Department had approved as well. I checked in with the subdivision review committee yesterday because I think their deadline, according to our subdivision ordinance, is 15 days after receipt of the application. They got to forward their approval or disapproval to the commissioners. And I knew that deadline was yesterday. John responded that they would have it out by the end of the day yesterday.
I'm not going. I do have something, you know, office on my computer, but I have to go there to get it. Wow, that's great.
Yeah.
That's what Freddie carries his luggage.
Yeah.
Okay, Ben, that's all I need to know right there. I'll call you later, Ben. Middle of the meeting. Thank you, sir. He said that it's at the state level now, and we haven't gotten back to the final word on it. And I told him I'd call him later and make sure we got the final word or see where it's at. So that's where it's at, Phil.
I'm not sure what happened there because that's why.
I don't know.
Engineers. So we were good to go. So just for clarification, as soon as we have that back, then I can have to come back to the next meeting.
Then you'll go subdivision review. And
Yeah,
then you'll finally come to us again. We'll get to see you again.
Well, normally if he gets that paperwork back from the state, he will go to the subcommittee, the subdivision committee, and say, here's the state's approval. It's okay. And then they'll sign off on it.
So assuming that comes in, then at the next meeting, they'll set the public hearing, which will probably be that first meeting in May. Whatever that date is. And we have to send out notice and I'll need cash.
Well, I
writers
mean, it
assistance with
could even come in by the time our next meeting is
Yeah, but you still have to
in
have the
April,
public
but
hearing.
we still have, yeah.
You'll still have to have so you're considering that you don't have the health department on board with it yet, your earliest opportunity for the public hearing will be the first meeting in May.
Assuming we get that approval.
Right.
I have no idea what happened.
Well, I mean,
Yeah, I was
it
under
kind
the
of sounded like to me, you know, with Ben and talking to the committee that Ben thought it would go through no problem, but he hasn't gotten back yet.
I think maybe it's not a problem. And we might still have the paperwork to back it up. I agree if
That's possible.
Well, that's all I have.
Thanks.
All right, thanks, Phil. Appreciate it. Next up, acknowledgement of the TIF management annual report.
Everybody received this, didn't they?
Yes, sir.
Email.
Yeah.
Okay.
Acknowledge it.
All we have to do is have you acknowledge it and we put it in the minutes. So
Same thing like we do with the clerks and,
Yes.
and yeah.
American Rescue Funds, we were notified that Gibson County will receive 6.53 million. First installment be May 11th, 2021, and the second installment, May 11th of 2022, the following year. In talking with Debbie Bennett she said we'd have to put together sort of a team, if you will. She said a lot of counties are putting together like their attorney, commissioner, a county council member, auditor as their primary team, but then of course taking input and ideas from anybody they find within their group that has, you know, some good ideas or projects. Something I want to share with the commissioners, talking with Debbie, and you may have already heard this from her too. If I'm repeating something you already know, I apologize, but she said some of these communities are like, let's go do this, let's do that. And then maybe not planning for, you know, I mean, heaven forbid we'd have this pandemic resurgence or, you know what I mean, more
Right.
problems. She said, I would be careful with your planning on that money and, you know, kind of like your parents always said, don't go out and spend it all at once.
Yeah,
right?
don't spend your paycheck.
Right.
But don't you have to spend The first part before you get the second one?
No,
I don't
I thought
know.
you did.
I don't know.
no, on this, it expenses on the plan, and as the state said, because I listened to a webinar, a couple different ones on it. It goes to 2024.
I heard
the
that.
end of 2024. So unlike the other that had to be done by, December 31st and all this. And the plan, as they put it, you should make the ordinance or resolution, I can't remember which one it is. More general enough that you don't have to go back and change it all the time, but realize that your plan will change because we're going to get, all we have is kind of general parameters right now. We don't have any specifics, and it's coming out of Congress, guys. Sorry. And so as those come in and the differences, then that's when the plan would probably have to be shifted. And they kept saying, just remember, you're gonna have changes. That's all there is to it. They're gonna have a little over 2 years to change the plan. We're just, and they said also it's possible you may have to change your resolution or ordinance, whichever it is, resolution, according, to what they say. But right now, all we have is general. And of course, the thing is, some of those generals might change too.
Right.
But so that's, and they did reiterate, the commissioners need to work with the council and whomever else, and the auditor's office, I know, has certain parameters they have to have, how they have to set the money up. And which is not, in all honesty, it's not that big of a deal. Right, Christie?
Yeah, Debbie led me to believe that it was all done locally and as
Yeah,
far as
no,
using it.
as using it in that, but
Documenting it.
they are putting certain parameters on it. You can't just go out and say,
Sure.
I got $6 million, I'm gonna build the Taj Mahal, a little one, but and like you said, we have to remember that it's not COVID money, it's COVID related recovery money, which is different than what the other monies was. So it's gonna be a pretty long process, I think, overall.
That's a nice segue into the resolution. Mr. Spindler?
So I prepared, I think this is the correct numbering, 2021-4. And it provides, I'm gonna just read the relevant parts. The money shall be used to respond for one of the following purposes. A, to the public health emergency with respect to COVID-19 or its negative economic impacts, including assistance to households, small businesses, and nonprofits, or aid to impacted industries such as tourism, travel, and hospitality. B, to respond to workers performing essential work during the COVID-19 public health emergency by providing premium pay to eligible workers or eligible workers of the county that are performing essential work, or by providing grants to eligible employers that have eligible workers who perform essential work. C, for the provision of government services to the extent of the reduction in revenue of the county due to COVID-19 public health emergency relative to revenues collected in the most recent full fiscal year of the county government. And D, to make necessary investments in water, sewer, or broadband infrastructure. So that is the substance of the resolution. I did forward this to Debbie. She has taken a look at it and has approved it. And so I would ask for a motion to approve resolution 2021-04.
And as you can see, that's pretty broad.
Do we have a motion to approve resolution 2021-04?
I'll make that motion.
Have a motion made. Do we have a second?
I'll second that.
Motion made and a second. All in favor signify by saying aye.
Aye.
Aye. Resolution 2021-04 has passed.
Now all we have to do is come up with a plan.
Yeah.
Hey.
I do need a copy.
Okay. Commissioners and county attorney, do you have anything else that maybe we missed along the way or need to address?
I have nothing.
I don't have anything that I know of.
Okay, if not, I'll accept the motion to adjourn.
I'll make that motion.
I'll second.
Yeah, second, all in favor, signify by saying aye. Aye.
You can't, yeah, it's got papers
Hey.
to sign.
But I don't have a mask on.